Good morning.
Morning.
All right, we'll call the Health Committee. We will call the Health Committee for April 26th to order. With today's agenda, the first bill, we're going to move up Senator Coleman Madison. But before we do that, we're going to take roll call and get everybody, make sure everyone's here.
Representative Lee?
Here.
Representative Lipscomb? Here. Representative Hall?
Here.
Representative Gray? Here. Representative Kitchens?
Here.
Representative Cole?
Here.
Representative Rigsby? Here. Representative Marcus? Here. Representative Holt Jones? Here. Representative Mooney? Representative Rafferty? Here. Representative DeBose? Here. Representative Sorrells? Here. Representative Shireen? Here. Representative Warren? Here. Got a quorum.
Okay, I will be calling up, ladies and gentlemen, SB 109. Up ahead, Senator Coleman Madison, would you please come forward? There you are. This 8 House bill members has passed in the Senate, so it is actually, the House bill has already gone through, but just to make sure that all I's are dotted and T's are crossed, since you're here, we're going to go ahead and get this same one out. It's identical to the one that passed already.
Thank you, sir. I think you all have heard this again, so I'm not going to go through. As you know, this is a social work bill, and social work's in a dire need right now, so I'm not going to go through the whole spiel unless there are any questions. It's the same bill that you all have already passed.
I have a motion for a favorable report and a second by Shiree. And first was by Marcus. All those in favor by saying aye. Aye. All those against, nay. Bill passes.
Thank you, Mr. Chairman. Thank you, committee.
Okay, thank you. Okay, Mr. Vice Chair, I will pass it off to you for the public hearing.
Thank you, Chairman. Next up is going to be HB 306 relating to teledentistry. Do we have our? Yeah.
I'll let him do the bill, and then we can call it.
Thank you. Chairman, would you like to introduce your bill? Oh, sorry.
Oh, you want me to introduce the bill?
Yes, sir.
Okay, all right. So this is HB 306. If many of you remember last year, we dealt with telemedicine and tried to get some control over that, and it was an effort by a ton of different people to take control of the telemedicine. It was Wild Wild West. So there's some of that that's happening, believed to be in the teledentistry. This bill will have some contact, require some contact with a dentist prior to the process and thereafter each year. Sometimes if you have a dentist or have dental work or, I guess, moving of the teeth, it's a 2-year process. And so the goal here is to at least have the individual in front of a doc to begin with, to make sure there are no other issues, and then each year after that, while you're going through this process. Most cases, that only takes 2 years. There needs to be, the belief is by the doctors, dentists, that there needs to be a dentist on record to provide patient care if an emergency were to arise. But that is what this bill is about. We have a couple of people, Mr. Chairman, that would like to speak in favor and against it. So,
Thank you,
with
sir.
that being said,
We have 2 people talking today, 1 for and 1 against. We're going to start with Mr. Carlos. You're going to have 3 minutes to talk. You will be instructed to terminate your conversation immediately upon the 3-minute mark.
By Carlos, I assume it's Colas.
Apologies.
Okay, just making sure. Okay. So, dear Chairman, members of the committee, my name is Ray Colas. I'm here today to testify in opposition to House Bill 306. Smile Direct Club strongly supports the bill sponsor's commitment to consumer and patient safety. Unfortunately, this bill discriminates against the use of innovation, affordability, and access to care by creating unnecessary barriers to those who seek teledentistry services for clear aligner therapy, similar to those services provided by our company. Should this bill pass, Alabama would be the first state in the country to prohibit asynchronous communication between a patient and his or her dentist, require an in-person visit prior to receiving teledentistry services, and prohibit a dentist's ability to determine the appropriate level of care that should be provided to their patient on a case-by-case basis. Additionally, in 2017, the Alabama Dental Board attempted to adopt similar regulations with the support of the American Association of Orthodontists to no avail. Those actions led to the FTC to investigate the board's actions, which ultimately led to a consent order in December of 2021. The order concluded that the board's attempt was nothing more than an unreasonable restraint of competition and to cease and desist from directly or indirectly restricting the use of remote teledentistry services for clear aligner therapy. Smile Direct Club also, in itself, entered into a settlement agreement with the board under the same pretext, which is effective until 2031. By enacting a clinically unsupported mandatory in-person examination requirement, House Bill 306 would restrict our ability to operate in the state, just as the dental board sought to accomplish and has been restricted from pursuing, either directly or indirectly. I would like to thank Representative Lee for the opportunity to engage on House Bill 306 and respectfully ask members of the committee to vote no.
Thank you, sir. Our next in support of 306 is going to be Mr. Khan. Is that correct?
Thank you and good morning. My name is Chung Hao Ka. I'm the Department Chair for Orthodontics at the University of Alabama, Birmingham. And I've been asked to talk in support of the bill. I have no financial interest in this other than being a responsible orthodontist and dentist for the community for Alabama. I teach my residents on a daily basis to diagnose treatment plan and to correct mid-course corrections on their treatments to ultimately give the best outcome for my patients. Orthodontics as a whole is not just about straightening teeth, it's really about the ability to give a functional bite, a functional outcome to all our patients. And I think it's paramount that someone take that responsibility who is well-educated, well-trained, and has also the experience to be able to do some of this work. So I applaud the bill in many ways, as it acts as a basis, and even almost on a minimum basis, to be able to go ahead and serve the public, serve the patients of the state. And I'd also say that at this point in time, we're not the only state that's passed a similar bill that supports this kind of work. So from a standpoint of an orthodontist, a standpoint of a clinician, I fully support this as it moves forward. So thank you very much.
Thank you, sir. Before we go any further, I'd like to introduce an amendment to HB 306. I think most of the committee members have received this amendment. Basically, the synopsis of this amendment is to add language to Section 3, which would ensure that we're not creating an automatic obligation for a dental or health insurance company to pay for the procedures that take place. All those in favor of this amendment, say aye. Any opposed? I'm sorry, we need a motion. Motion first. Let's do this again. All those in favor, aye. Opposed? The amendment passes. Is there any further comments on the bill?
Thank you, Matt.
Yes.
Mr. Chairman, just wanted to remind and reiterate the importance of just that contact at the beginning, in the middle, and possibly at the end. At the beginning of the process to make sure there are no other issues, and then some point within the next year. It's not like you have to go and do it regular. It's, if you'll remember when we did the telemedicine, those of you that were here last year, there was a requirement after so many visits you had to make a face-to-face contact with a physician. It's just important that that happens, and this is the importance of this, moving teeth just in the different areas of the mouth, and everyone is not the same, and this could cause an issue. There was some discussion just a minute ago about the legal process that had taken place. All that did happen, but they wanted to try to get this done without having to come through legislation. It failed, and now they're coming through legislation to take care of it. So they're doing it in a manner that no one has control over that decision other than this body and the body in the House and the Senate. So this is a process they've chosen to take since it did not work the other way. Yes, ma'am.
So as we talk about the consent order, this in no way conflicts with the order that has been issued. or
That is-
not going around the order.
That is my understanding, simply because that dealt with them and the way they were handling it before. If they handle it through legislative body, that group has no control over what decisions made in our area.
Thank you.
Are there any other questions? Seeing none, can I have a motion? A second? All those in favor, say aye. Any opposed? Bill passes. Chairman?
All right, thank you. Okay, next bill on the agenda, SB 66 by Senator Melton, and Representative Bedsole, you'll be carrying it.
Yes, sir. Thank you, Mr. Chairman. May I say that is a fine-looking coat you have on today. It's awkward walking in, and we were dressed alike. I'll say that.
I think there's a little bit more thread in mine than yours, though.
Does that help my chances or hurt my chances right now?
My wife laid mine out. I don't know about yours, so it's good.
Thank you for your patience, Mr. Chairman, and members of the committee. I'll just apologize in advance because this is a bill that I was standing before you a couple weeks ago on. As you recall, we had SB 66 that came from the Senate. Senator Melson carried it, and HB 219. A couple weeks ago, we married those two bills up, and our intention was to move 219 through the process because if you recall constitutionally, because it was a generating revenue bill, it had to start here in the House, and that was our intent. After that day, we experienced some issues really that detracted from the original purpose of the bill, which is to keep these psychoactive cannabinoids out of the hands of our children. These are sold in convenience stores with no regulated access at all. Simply, a lot of them are marketed towards children and are finding their way in the hands of children. So we wanted to get back to the original intent of the bill. So what I have before you, at the appropriate time, we'll have a sub that will clean up a little bit of the language to make this an even better bill, but it will be with the original intent, which is to regulate these products to the possession, marketing of anyone 21 years of age and older.
Are there any questions? Just to kind of clarify, and many of you, we've been through this process, and through the bill, there was a little bit of chasing rabbits as far as trying to determine the tax that would be coming in from it, and this and that and the other. And so basically what's happened is kind of gotten back to the real purpose of the bill to make sure that this is not out there in front of children or those under a certain age. And there will be a tax collection, but it'd be normal that everyone that sells it will not have to alter their process to collect an additional tax. So we're getting back down to the basics as far as tax, just like everything else is, plus the real purpose of the bill.
That's correct. Well said, Mr. Chairman.
Yeah. Are there any other questions, motions on the sub? Representative Hall.
As I read through this, when you on page 2, starting at lines 32, we talk about individuals under the age of 21 who are in possession. And then as you move through it, then you're forwarding a record of their convictions based on, so I'm looking at the citations or the amounts. And then all of that information is forwarded to the state law enforcement agency, the secretary, and their driver's license are suspended for not less than 6 months. So we're talking about one part is about the person that's selling, but the other part is about the individuals who may have possession.
Yes, ma'am.
How does that differ from the law that we presently have on the books as it relates to marijuana?
I'm not sure about marijuana in regards to the law. This is a very specific product, Delta 8, Delta 10. So I'm uneducated on how that applies there. And while we're at that spot, Ms. Hall, I'd like to point out for the committee members, we did add in an element of community service here. So it's not all about fines, that it opens the door that if a jurisdictional court decides they would like to impose community service on an individual, it gives them the option and ability to do that.
But either way, that information still goes to. I mean, you're building up. You're building. You hear where I'm, and I received a copy of this earlier, and I was
ma'am.
busy doing something else. But anyway, that's my concern. You building a case of individuals under 21, and not that we shouldn't, but also the community service. But all of this seems to be whatever their conviction is, it does go to these different agencies, and I'm interested in how does that differ from what we presently have on the books.
Yeah, I don't have the answer to that. I'm sorry.
We'll find out. Thank you.
Any other questions or motion? Move favor report by Representative Lipscomb. Second by Representative Shiree. All those in favor of this by saying aye. Those against, nay. This is the final bill. No substitute.
That was a substitute. Now we need to go.
Okay, that is a movement for the substitute. And now we're voting on the final bill as substituted. I'll need a motion. Motion by Representative Soros, second by Representative Kitchens. All those in favor by saying aye. Those against, nay. Bill passes as substituted. Favor report.
Thank you, Mr.
Okay.
Chairman, members of the committee.
Okay. Okay, next bill is HB 290, and we have no one amendment to it, and there may be others coming, but if you will, Representative Rigsby, HB 290.
Sure. Under existing law, pharmacists are able to administer vaccines in the state of Alabama. In the COVID era, there was an act called the PrEP Act, which allowed the pharmacist to prescribe vaccines to administer to a patient. Some pharmacists in the past have worked under standing orders where a physician would sign a blanket order, but it was the pharmacist who was administering, determining the appropriateness of that vaccine, and monitoring the effects in the short term of that vaccine after administered. What this bill would do is it would codify the ability for a pharmacist to prescribe and prepare and administer a vaccine to patients in Alabama. This does apply to adult vaccines, and currently the bill, which the amendment will change in a minute, to pediatric vaccines, COVID, and flu. The amendment that we will introduce in a minute will remove the pediatric vaccines as we feel like it is important for those patients to get in front of those pediatricians and have those well baby visits. And so if you have any questions at this time, I don't know if the chairman wants to go ahead and introduce the amendment, but if you have any questions, I'll answer questions.
Yes, sir, I do, but let me get my papers here in order.
You're fine.
Mr. Chairman, may I go ahead and ask some questions?
Questions?
Yes, sir.
Yes, sir.
So, Mr. Rigsby, you mentioned the PrEP Act. Can you describe what specific situation generated that particular act?
COVID.
Okay, so before this PrEP Act did not exist.
Correct.
Okay. Now, you had mentioned in your bill that these some of these vaccines were from ACIP. Who is ACIP?
Let me look that up. Because you know me and acronyms. There's too many of them. The
Advisory Committee on Immunization
That's it.
Practices.
Yeah. Advisory Committee of Immunization
And
Practices. That's correct.
they have a standing board of 15 people.
Okay.
Of those 15 people, how many of them are pharmacists?
I don't know.
It's 13 MDs, the physicians, one nurse, and one lawyer.
Okay.
You mentioned the difference between prescribe and administer.
Correct.
Can you define that difference for me?
Well, the way I would understand prescribe would be an authorization to actually initiate therapy based off the determination of need for a patient. Administration would be the actual dispensing and administration of a prescription or in this case, vaccine.
Okay. So when you prescribe something, is there a medical decision-making process that goes through that?
Yes.
And what included in that definition process do you have?
In the word prescribe,
Mm-hmm.
well, it would be the ability of a practitioner of any kind
Mm-hmm.
to analyze a patient, their need for therapy, the reason that that therapy would either be contraindicated or needed, and then make a clinical decision based off of the information presented for that patient, whether that therapy is accurate, needed, or necessary.
I would actually add too on that, and the particular component is what's called a patient history. And that actually, believe it or not, Dr. Osler actually came out and said 80% of the diagnosis is actually in an accurate history. So, and history is really important when you're actually doing any kind of medical decision making with a patient. On your bill, can you define line 31 through 33 for me?
Well, the Board of Pharmacy, according to Act, let's see. Let me find the actual law. I think I have it in this folder. Determines the vaccines that can be administered by a pharmacy, and I thought it was in here.
I'm asking that because, like Ms. Hall, when I see that the law, I'd like to know what law is referenced
Sure,
to.
I understand. Give me just a second. Like, here it is. Section 680-X-2-.46 it's defined as immunization training, and it talks about a pharmacist, intern or extern, must have and maintain the certificate of training to administer vaccines in Alabama, and that's been interpreted to be vaccinations in Alabama.
Okay. But administering vaccinations, correct? According to that, not prescribing vaccinations.
Current law is administer, not
So
prescribe.
in that particular law, there is no definition for prescribing.
That's correct.
Okay. In your bill, you have a vaccination on ACIP's 13th, or for adult vaccinations. Let me see if I can read this correct. Now, it's age 13 through 18. Is there any exceptions that you would recommend that they not get that?
Well, if we pass the amendment, that won't apply.
Okay. So, or what about nasal flu?
Nasal flu, well, in our practice, is not used anymore. But I mean, it would not, in my understanding, would not be covered under immunizations.
I am actually looking at the CDC guidelines here, but by ACIP, which you had referred, and that is on here.
Well, let me pull up the. Are you looking at the CDC recommendations? Or
That is correct.
For an adult? Or
We can
pedi-
do adult, or I'm actually particularly
looking at-
children too,
right,
but
well,
yes, we'll do both.
Well, I mean, again, if we take out children, we're just talking about flu vaccine.
Well, I know, but I'm specifically talking about the bill as it is right now. I'm not allowed to not question it without an amendment.
Right. Well, I mean, that's the way I would interpret that. Is it would just be influenza vaccine.
Okay. So if we did give this to somebody, let's say a spouse,
Correct.
or a close family contact,
Correct.
would that be a problem with any jobs?
If you gave the nasal spray
Mhm.
to a
Let's say that my wife came up and says, you know what, I don't want a shot.
Yeah.
I'd like to have the flu mist.
right,
Can she get that?
I would have to evaluate if she qualifies for that. And
Let's
if
say
I
she's
can-
perfectly healthy and no issues.
Well, I would have to, if she is perfectly healthy and no issues, and she meets the requirements of what it would take to administer that vaccine, and I'm authorized to do that,
Right?
then we would administer it.
You
But
just
it's a live
not
vaccine.
prescribe it.
It's a
administer
live
it, though.
vaccine.
Right.
I said, well, if I'm allowed to do that.
That's
Again,
correct.
Pharmacists historically have not administered flu mist.
Right. Because one of the major contraindications for that is asthma,
Right.
and also close contacts, especially with healthcare workers, because it is a live.
It's a live
vaccine.
Right.
So those are particularly important. What about MMR? That's a classic pediatric
Correct.
vaccination. Any issues with that one?
Are there contraindications? Is that what you're asking?
Mm-hmm.
Absolutely, there's contraindications.
Okay. Also on
I
the
mean,
ACE.
every vaccine has contraindications.
Okay. So any particular one that you would recommend? Because, you know, it also affects people over the age of 65.
Correct. But I mean, as far as the way vaccines are looked at when you go to administer a vaccine, that's part of the evaluation of, is this contraindicated for that patient based off their history, based off their current health, based off their medication, based off their allergies, based off the current situation. That are they feverish? Are they not feverish? Are they sick currently? Are they not sick currently? All of that would be taken into consideration.
You mentioned something very interesting, and you talked about the health of the patient. In the training of pharmacy, do y'all do a lot of patient intakes as far as health investigations?
Yes.
And you do?
Yes.
Can you describe your interactions in that particular class to get the patient medical
Well, in the
history?
particular class or the particular interactions?
Let's talk about the educational portion.
Well, educational portion, you were just trained to do intake of medication and health history.
Okay.
Same thing as I was trained as an EMT to do health history.
Okay. Do you actually go through a course that actually talks about how to talk to patients and how to gather a history?
Absolutely.
Okay. Can you just, how many hours is that course?
I couldn't tell you. Okay. But I know that we actually do patient contact in our personal rotations to actually do this on a real life basis under the training of a pharmacist, of course.
Now,
Representative Cole, let's wind this one. I have a question or two myself.
Okay.
Okay.
So when we're talking about here, I've also got a thing here called NASPA. Have you heard of them?
Yes.
National Alliance for State Pharmacists?
Yes.
And the American Pharmacist Association.
Yes.
Yeah. Now, they have something out here that's very interesting that they put. They list a thing of places that our states are allowed to administer.
Yeah, it looks like this.
Something like that.
Yes.
But it also actually says that it's usually used for public health emergencies, and that would fall under what we discussed with COVID, correct?
Correct.
Okay.
And the PrEP Act was extended 2 weeks ago by the federal government to sunset in 2024 with the intention of having the state's ability to get their ducks in a row so that the access to vaccines does not decline.
Oh, no, wait a minute. Access is different than prescriptions.
Correct.
The administer is what we're currently doing right now, correct?
Pharmacists can currently administer,
For COVID and flu.
well, they can prescribe for COVID and flu
Right.
right now.
But they're not being able to prescribe for, let's say, a varicella for a pregnant lady.
Correct.
Or-
They would have to have a standing order for
Or
that.
a rusty nail that someone stepped on for a Tdap, but it's been only 5 years.
They would have to have a standing order for that.
Okay. All right.
That's correct.
Any
Thank
other
you, Mr.
questions
Chair.
from anyone else? I have one myself.
But let me point out, Mr. Chair, real quick about those standing orders.
Okay.
The physician that signs that standing order. When I had my pharmacy, I had standing orders. I paid $199 a month for a physician in Birmingham to sign that order. Never once did that physician lay eyes on any of my patients that I administered vaccines to. Not once.
That was my question. The last 3 years, if this bill passes, what changes other than what you've been doing the last 3 years for you in your everyday work?
What changes?
Will there be a change?
If it
in what
passes?
if this passes,
If it passes, the ability to get access to vaccines increases for patients in the state of Alabama.
yeah, but your daily process every day, you're walk in and do the same thing you've done
Correct.
for the last 3 years.
That's correct.
If we give the ability for the public health officer to administer this across the state, what would change by doing that than what you're asking for? Your day-to-day decisions
nothing
would be the very
Would be
same,
the very same. That's
Okay.
correct.
and with what you've been doing over the last 3 years.
That's correct.
Okay, I have an amendment. Okay, to remove lines 36 through 39 on page 2. And what this does is prevents a child from getting a vaccine in that area. It'd be 19 years of age and older would be only those that qualify. I just think it's very important that these children need to be in front of a pediatrician at least once a year if it's for nothing other than vaccines. A lot of people didn't grow up in an environment that a lot of us did. This may be the only opportunity they see a child that could be abused or whatever the case may be. So with that in mind,
And that's friendly amendment.
okay. All right, got a motion for Lipscomb, second Representative Marcus. All those in favor of the amendment, please by saying aye. Those against, nay. All right. So we now have a bill with an amendment. Do we have any other business to take care of on this bill.
Yes, Mr. Chairman, I have a substitute bill that I'd like to discuss
Okay.
for HB 109.
Okay, this is a great learning moment.
Yes, sir.
For the carrier of the bill. Those of you who haven't been here, the same thing here will be on the floor. The carrier of the bill has basically three options. He can say, like he did just a minute ago, that it's a friendly amendment, or he can second say, guys, let y'all vote however it falls. We'll go with whatever it does, or he can make a motion to lay the amendment on the table. And then we will have to vote to remove or substitute, in this case, the substitute on the table. So just kind of giving you an idea of the three options that will happen. I have no idea, but we will find out.
Thank you, Mr. Chair. As mentioned in this particular bill, the substitute bill, excuse me, do you have that in front of you, Mr. Rigsby?
Yes, sir, I do.
Okay. I am substituting this bill because I believe that there are several conditions in adult as well as children that the state health officer, while I know that they probably, you say, did not look at the patient, they actually probably reviewed the records. I would actually argue that the state health officer, this particular bill does not hamper the administration or the access to patients in the rural area. And I would like for you to consider this substitution for your bill.
I would move that we lay this aside on the table.
Okay. Yes, sir. For this particular thing.
So
No, I would like a vote on this.
you would like a vote?
I roll, please.
Well, at this point, okay, I was talking, I'm sorry. Did you introduce the substitute?
I did, sir.
Okay,
made a motion to table.
You have a motion to table it?
Made a motion to table it.
So we have a second to table it by,
Who's first? We need a second.
okay, second by Representative Marcus. This is he has chosen to table the substitute. Yes. Okay.
He made the motion.
Got a first and a second, Lipscomb and Marcus, and he has chosen to table. Just to clarify, that means he's setting it to the side. We are now about to vote on the tabling of the substitute. If you aye votes, will be to table the motion. All those in favor by tabling the motion by saying aye? Aye. Those against?
Nay,
Had 2 nays. Do you want a roll count?
please.
Oh, we have to have a second for a roll count. Do we have a second for a roll count, or we want to let that go? We have no second.
Okay. And Mr. Chairman, I appreciate it. Thank you very much. I still have significant concerns, even though the pediatrics is out. This does not address pregnant ladies. It does not address the health care and concerns of people that are immunocompromised. And it does not address any of the other medical conditions that a health care provider has to use their clinicianal skills to make sure that the vaccines are administered properly. I think this bill needs some more work. I'd like to make a motion that we table the bill to subcommittee so we can continue to work that. I feel confident that we can come up with something in the subcommittee that'll satisfy all parties.
Failure for a second. You second it? Okay. And your motion was to?
Table this particular bill to the subcommittee so we can continue to work on it.
Mr. Chairman, do I have the ability to table that motion?
No, I don't. We're going to vote on it.
Okay. So can I get a
All
vote?
those in favor of sending this to a subcommittee would be a aye to do that and a nay to not. If you're in favor of sending this to subcommittee, well, to be honest with you, that's my choice, isn't it? Isn't that the chairman's choice?
We just sent it to subcommittee, but they can make a motion to table the bill.
Representative Hall? Okay, I have a motion, a second. Those that want to send this to a subcommittee by voting and saying aye.
Aye.
Those against, nay.
Nay.
Nay. Nays carried it. Now, we're back to the bill as amended. Those in favor by saying aye? Aye. Those against?
Nay.
Okay. Motion carries for a favorable report. That concludes our exciting meeting.